Dental decay is the most common disease in the world. It is caused by sugar in your diet. You need three things for decay to happen. You need teeth, which you have. You need bacteria in your mouth, which you have. And you need sugar, which you do not have unless it is in your diet. Once these three things come together, decay can happen. The more sugar you have over a period of time will determine how much decay you do have in your mouth. Decay affects the hard tissues of your mouth, i.e. the teeth. Whenever you have decay, it eats away at your teeth through the enamel into the dentine and creates a cavity. Once that cavity has been created, it is not reversible. If it is left, then the cavity will get deeper and deeper and go towards the nerve, potentially causing pain and therefore requiring root canal treatment. On the extreme basis, at the extreme level, the decay will cause tooth extraction because there's not enough tooth to fill. Here at Gallagher Dental, we try to get to the decay at the earliest initial stage. We want to keep the fillings as small as possible, where there's going to be less damage done to the tooth. The deeper the decay, the more damage there is done to the nerve and the more likelihood there is for needing root canal treatment or extraction. Once there is decay in your tooth, the decay needs to be removed. This is done by drilling, the fast drill, the slow drill, then a lining is put underneath into the deepest part of the cavity and a filling material is used to fill up the tooth. There are different types of filling material. There's amalgam, the silver filling material. There's composites, the white filling material. There's glass ionomers, a different sort of white filling material. Our choice of filling material is a ceramic filling material. We use ceramic. The trade name is Admira, made by Voco in Germany. We use Admira because it is more stable than the composites. It is harder wearing than composites. It has no free radicals or monomers like composites have, and it has a better tensile and stress fracture level than composites. We use those Admira fillings as our default. There are other times we may use amalgam, other times we use composite or glass ionomers, but generally we will use Admira white filling ceramic material. Filling appointments are 1 hour where we numb your tooth up, we dig out the decay, we put a lining and we put the filling in. We check the bite and check the contacts between the filled tooth and the tooth next to it, and we make sure that it's polished and smooth. We also glaze the filling so that it's a smooth, polished surface on the filling. Yes, depending on the extent of the breakage of the tooth, we can fill the tooth. In more recent times, filling materials have become more adhesive, so therefore we can use the adhesive properties of the Admira, of the ceramic filling, to help hold the filling in place. In certain circumstances, we can put a little pin in that halfway goes into the tooth, that sticks up out of the tooth, around which we can add the filling material to the tooth and recreate the tooth again. Sometimes, if the filling or the cavity is too large, we would advise you to have an onlay, an inlay, or potentially a crown. The advantage we have here through a 3D scanner and HD camera, that we can show you the journey that the filling takes. We'll take a picture before we start, we'll take pictures throughout it. We will also show you how deep the filling is, and the depth of the filling will determine how much post-operative pain or sensitivity you will have. Again, if it is very deep, you will or potentially may have sensitivity for up to 10 days. If it lasts any longer than that, it suggests that the nerve has been damaged significantly from the decay in the first place, and the tooth may need root canal treatment. If the nerve is exposed, the tooth can still be filled, depending on the level of exposure of the nerve and depending on how much decay was there in the first place. The decay will penetrate into the nerve chamber itself. The nerve chamber itself, because of the trauma from the decay and subsequently from the drilling, will try to swell up after the filling is put in place. The problem with this nerve swelling is that it's got nowhere to swell, and therefore it will manifest itself as pain. If you hurt your thumb, it swells. If you hurt the nerve on the tooth, it cannot swell because it's surrounded by a filling and surrounded by the tooth. If this is the case, more than likely you will require root canal treatment, but yes, a tooth can be filled where the nerve is exposed as long as it is a small exposure, but there can be post-operative pain and sensitivity. Mercury is used in tooth fillings. They're used in the metal fillings. Mercury consists of around 50% of amalgam fillings. They're being phased out, and that's why we in Gallagher Dental here have tried to find the best alternative, and we've found that in Admira. We have used composites for years, but they tend, in my view, they tend not to last as long as the old silver fillings or as long as the Admira ceramic fillings. If you'd like to make an appointment at Gallagher Dental, you can do so by phoning us on 01 678 8158. Alternatively, email us at info@gaadental.com, or you can visit our website and book online. The website address is www.gaadental.com. We look forward to having you as a patient, and we'd love to see you and hopefully have a long and rewarding relationship with you.